Go ahead, Leanne.
All right. Well, then I want to thank you all for being here today, and we're very excited to have Amanda DeStefano speak to us. She works for the State Department on Aging, and she manages the Maryland No Wrong Door, the Maryland Access Point. She's going to lead our discussion today, but before we get to that point, we're going to see like where we are on our goals and objectives. The first one was to integrate a statewide system to support the access and sustainability around these evidence-based behavioral change programs. I think we're doing a really nice job with that. We're getting contracts around these HART funds more and more all the time. So I think we're moving right along on that objectives. The next one was to implement standard screening for the state for the social determinants of health need across the CBOs and with those providers. We're in the process of actually embedding that statewide screener, which we work together with like Amanda from Aging a few months ago, and we will be making this part of CRISP and a part of workshop, a part of that workshop a wizard. Establish a multicultural aging network and create that a reimbursement along with working with the multicultural. We've done a really good job at that as well, with those kind of working relationship with, I would say 3 to 5 of those multicultural organizations. Working with Maryland hospitals, Maryland primary care, around that return on investment piece. We have done that, and we're now able to run our own reports. Also, by leveraging the existing contracts to pilot the those reimbursement models, and I mean, we are receiving funding from outside sources. So that is where we are currently on what our goals and deliverables around this national network lead. Next slide.
I want to remind everyone, if you could kindly put your organization name after your name on the Zoom link to help us identify folks. And I'm going to turn this over to Amanda.
Yeah, thank you.
Thank you, Wendy. I appreciate the opportunity to share a little bit about what's happening in Maryland around Maryland Department of Aging. As Wendy introduced earlier, my name is Amanda DeStefano. I work for the Maryland Department of Aging. And I've been with the department for about 2 years. Prior to that, I worked at a local area agency on aging, which serves as our Maryland Access Point sites across our state. And I'm really excited to share more information with this group about what MAP is doing and how they are doing what they're doing here in Maryland as part of the No Wrong Door system. Some of you on the call may be very well versed in MAP. Some of you work in MAP. Some of you are direct partners with MAP, and some of you, this may be new information. So if you have any questions, you hear something new today and want to learn more about it, please feel free to reach out following to today's presentation. My contact information will be provided at the end of the presentation. With that, I'll go ahead and get started. Wendy, if you want to go ahead and advance the slide. So I always like to start these presentations by just sharing a little bit about the Maryland Department of Aging and how Maryland Access Point fits in to what the Department of Aging is doing. Here at the Maryland Department of Aging, our goal or our vision is to change the trajectory of aging. We want to help Marylanders live active and independent lives in the community for as long as possible. And all of our programs that we offer and the collaborative partnerships that we have are all geared toward reaching this goal, changing the way that we view aging in this state and helping ensure that all Marylanders are able to age safely in the community as long as possible. Next slide. There are a variety of programs and services that are offered through the State Department on Aging or in partnership with our Area Agency on Aging network. This programs and services that are offered fall under several categories. You can see elder justice listed there. And I'm just going to quickly give you a brief overview of some of the programs and services that are offered through the Department of Aging under each of these categories. Under the elder justice category, there are things like our ombudsman program that works specifically with individuals who are living in a skilled nursing facility or an assisted living facility to provide advocacy and education and awareness around rights for residents in those facilities. There's also some elder justice programs that provide advocacy and support for individuals who may have been affected by neglect or abuse and can provide some support in connecting the services and supports, as well as legal consult programs that are offered through each of the area agencies on aging that can support individuals with creating things like advanced directives, setting up things like wills or powers of attorney, or providing at least a resource to be able to better access and provide and set up supports in those areas. We provide information and assistance through Maryland Access Point. So I'll talk more specifically about how access to information is done through Maryland Access Point in just a moment. There are a variety of programs and services offered to address health and wellness, many that you've already learned through this NLE, a lot of evidence-based programs to support individuals who are aging in the community, food resource programs, home delivered meals, congregate housing, and meal delivery. So a lot of programs and services that are aimed at addressing individuals' health and their wellness. Aging in place programs that specifically address needs of individuals who want to remain in the community. We have a program called Community for Life, which I'll share some information about at the end of today's presentation, as well as some other programs that can address aging in place, like family caregivers, supportive programs, and education programs. And then, of course, we partner with lots of organizations at the state and local level to continue to expand the services that we are providing. Next slide, please. Maryland Access Point is one of the programs that the State Department of Aging is charged with overseeing. Here in the state of Maryland, Maryland Access Point, commonly referred to as MAP, so you'll hear me say MAP a lot in today's presentation, is what serves as Maryland's Aging and Disabilities Resource Center network across the state. Aging and Disability Resource Centers are not just unique to the state of Maryland. It is a nationwide initiative. And ultimately, the goal of Aging and Disabilities Resource Centers across our nation are to address the frustrations that older adults and people with disabilities, as well as their family members, experience when they are trying to access long-term care services and supports. If any of you have ever worked with individuals who are trying to access services and supports, you know just how complicated this can be. There are many services and supports available. Eligibility for each of those services and supports differ from service to service, or county to county, or even sometimes zip code to zip code. And oftentimes people make decisions based on inaccurate or incomplete information and find themselves in an institutionalized setting much before they intended to or really needed to. So as an example, let's say, I have a fall and I break my hip and I'm in the hospital and I'm not aware of all of the services and supports that can help support me in the community. And I think the only option that I have is institutionalized care, moving into a skilled nursing facility that can provide the support that I need to remain safe. When ultimately there are programs that can come alongside of me and support me in the community that I'm just not aware of. So our goal in Maryland Access Point, or MAP, is to help individuals understand the full network or the full range of supports that are available so that people can make more informed decisions about their long-term service needs. And additionally, We want to help people access not just private or public benefits, but also look into their private programs and services that might exist within their own communities or even in their own informal networks that might be able to support them to create a comprehensive plan to address an individual's needs on a holistic level. We provide all of this information and support unbiasedly. So there's no commissions, there's no advantage that Maryland Access Point staff have by sharing one program over another. We provide unbiased, reliable information and counseling to individuals, regardless of age, regardless of income. Next slide, please. This whole idea of an ADRC fits nicely into our Maryland No Wrong Door system. Ultimately, ADRCs are a vital part of the No Wrong Door system, which provides sort of a one-stop shop, if you will, for all service needs. Individuals who are seeking assistance with remaining in their community, with aging in place, who need some support and finding resources and services to support them. This is where they would call. Maryland Access Point is that one-stop shop for all of your service needs. No Wrong Door is designed to provide consumers seamless and timely access to information and services. And ultimately, the goal of our No Wrong Door system here in the state of Maryland is to provide streamlined access to long-term services and supports options for older adults and individuals with disabilities. Next slide, please. Maryland Access Point. This kind of work has happened in our state for quite some time. Well before 2004, these grassroots coalitions and groups and organizations were providing information assistance and referral to community-based organizations. In around 2004, the state of Maryland received some funding through a grant in partnership with AACL, the Administration for Community Living, that formalized this concept and really brought Maryland Access Point into what you see it being today as part of this No Wrong Door system, and helped us set up some policies and procedures around the way that services are being accessed in our state. The pilot started in just a few counties, and it has expanded to our entire state since that time. Initially, Maryland Access Point was, governed by several agencies at the state level. So we provide the lead at the Department of Aging, but we work closely with the Department of Health, Department of Disabilities, Department of Human Services, as well as the Governor's Office of the Deaf and Hard of Hearing, and many, many other state partners to provide oversight, guidance, support, policy development to guide and direct the work that's happening at each of our MAP sites across the state. Funding happens at for each of our local offices in a variety of ways. Many of our offices receive federal grants to support this kind of work. There's some state grants, state MAP information assistant grants, as well as state balancing initiative programs through our Money Follows the Person demonstration that provides some funding to support this kind of work happening in our communities, as well as work happening in a skilled nursing facility and or an assisted living facility to help individuals transition back into the community from those skilled settings. And there's also some additional funding that comes from Medicaid through the Medicaid Administrative Federal Financial Participation, or FFP, which is a billing model that helps sustain our current workforce across the state. Next slide. There are 20 local offices, 20 local MAP offices, all listed on your screen here. You will get a copy of these slides, and these slides will be available online for you to view. You can also get all of this information on our website. But there are 20 local MAP offices serving all of Maryland's counties. Most of our area agencies on aging are serving as the lead or the MAP site for their county, providing all of the services available through MAP. They work very closely with their Centers for Independence. Many of them are co-located or have co-located staff that can seamlessly provide services from aging and the Centers for Independent Living at the same time. And then we also work very closely with our local health departments, especially through the level 1 screening process, which we'll talk about in just a moment. Next slide, please. So what is MAP? MAP is for getting information about the full range of long-term services and supports. It is for helping individuals plan and develop actionable steps towards gaining access to long-term services and supports and meeting their supportive needs to help them remain in the community. It is for helping people get connected to the available resources that exist. I always like to say Maryland Access Point, similar to a cardiologist is the expert on health, our heart health, and a podiatrist is an expert on foot health. Our Maryland Access Point is the expert in community-based resources and supports. If you are looking for community-based resources and supports, they are your go-to to help you get connected to the available resources in your area. And MAP is also for encouraging individuals to first look at personal and community resources that make the most sense for them. We provide person-centered services, and that's really very important. Sometimes service delivery can get in the way of what a person truly wants. It might make sense on paper, based on eligibility criteria, to refer an individual to a skilled nursing facility. But ultimately, if that person doesn't want that type of service, that's where we come in. Our person-centered services look at what the person wants, desires, wishes, and takes that into consideration when evaluating the types of services that we're connecting individuals to. What MAP is not, so it's important to understand this as well. MAP is not considered crisis intervention. So we don't provide any direct service. If somebody calls us today and says that I'm homeless and I don't have a place to sleep tonight, we do not have a place for them to sleep. However, we can point individuals to the right place, to make some phone calls, to provide some advocacy, to connect individuals to the services and supports that they need. But oftentimes we aren't able to provide or meet that immediate need ourselves. We can kind of point people in the right direction. We're also not same-day service. Many of the services that Maryland Access Point offices are connecting individuals to require determination for eligibility, and we do not determine eligibility for public or even private programs. So there's oftentimes an application process that has to be completed and information that's gathered, and then it is submitted to an outside organization for determination of eligibility, and that process takes time. So oftentimes individuals are not able to receive same-day service. It's not an immediate fix. It can take a little bit of time. So we always like to encourage individuals to call Maryland Access Point before you need us. Don't wait till you're in a crisis and you're not sure what to do. We want people to learn about our services and learn about what's available to them in their communities before they need them, so that should something happen, they know exactly what to do and how to access the services. Maryland Access Point is also not case management in the traditional sense of the word. So while we do provide in many instances some quasi case management, and some of our local MAP offices work in partnership with their healthcare entities in their local communities to provide a little more close case management. Generally speaking, Maryland Access Point does not provide case management in that they're not following an individual for a predicted period of time or based on a particular goal until that goal is met. We are providing information, assistance, and referral. So people are calling in with a need, getting that need addressed, exploring other benefits, other issues, other resources that might meet their needs now and in the future, and then are instructed to call back when they need additional support. And then, of course, we also make referrals to more traditional case management. And lastly, MAP is not the yellow pages, although you'd be surprised some of the calls that sometimes come in and we feel that need. We'll direct you in the right direction. So while we do serve as a one-stop shop, we're not intended to be a yellow page resource. Next slide. Some of the core services provided to MAP include information and assistance, referral, MAP options counseling, and level 1 screens. These are the 3 components that exist in each of our Maryland Access Point offices across the state. All of the services offered through Maryland Access Point serve older adults and individuals living with disabilities in our communities who are 18 and older. Or anyone seeking services. So their family caregivers, their support persons and loved ones, whatever that might look like. So any individual looking for supportive services around their long-term needs are who we are aiming to serve. Next slide. To just give you some additional information about what information assistance and referral entails. Maryland Access Point provides outreach and education to their community. You might find a Maryland Access Point staff person at a community health fair or at a senior housing complex, providing information about different services and supports that exist in their community, addressing individuals' needs or concerns. They're also there to provide information, access to assistance and referral for a variety of other community-based resources, services, and supports that address lots of different things. Things like financial benefits and assistance, housing, personal care needs for individuals who need some additional support with their activities of daily living, family caregiver supportive programs, respite programs, education-based programs, or even support groups. They provide information, assistance, and referral around food resources, help people complete things like the SNAP application or connect with their local food bank resources, or understand where their congregate housing resources might exist in their communities. They provide additional assistance with connecting to transportation, helping individuals connect to transportation programs that can provide transportation at no cost if they might be eligible, finding resources at a lower cost, or can accommodate special needs, all kinds of different things. They address social engagement. So social isolation is a big problem. And Maryland Access Point helps individuals, especially through the Maryland the MAP options counseling process, really think through how to address their social isolation, referring them to evidence-based programs like Pearls, or getting them connected to their local senior center and the programs and services offered through there. They provide information around education programs to address health or whatever it might be that individuals might need. Connection to health and wellness. A lot of our Maryland Access Point our offices also serve as the local SHIP office. SHIP stands for State Health Insurance Program. Kate, did you have a question or thought? Could you just mute yourself?
我帮你泡吗？我也有吧，子韵也有给我。
Do you have the ability to mute? Perfect, thank you. All right. Maryland Access Point offices also connect individuals to legal assistance programs, elder abuse prevention and advocacy programs, and a variety of other resources and supports that, again, are aimed at helping empower people to make better decisions and have the full understanding of the resources and services that are available to support them. When we're talking about long-term services and supports, ultimately, we're talking about any program and service that can help an individual remain in the community. So how does a financial benefit fit into that? Well, ultimately, we want to help people free up finances so they can put more money back in their pockets at the end of the month, and they're not spending so much maybe on their energy costs or their homeowners taxes. They can put more money back in their pocket so that they can privately pay potentially for their personal care in the community, or support themselves in the community by purchasing durable medical equipment that can make it safe for them to remain in their home. So all of these things work together to address an individual's needs to keep them safe, active, and independent in their community as long as possible. In fiscal year 2023, Maryland Access Point reached 47,689 unduplicated individuals with these services. And then in addition to that, according to the Maryland Access Point quarterly reports, 231,440 referrals were made from our MAP offices statewide. That is huge reach. And let me tell you, it doesn't even begin to address the capacity, the demand for services that exist. The demand for services far outlies the capacity of each of our offices. Our offices always have growing pains and are always looking to expand so they can meet the need of the growing older adult population in our communities across the state. Next slide, please. One of the other core services that I mentioned that Maryland Access Point provides is a level 1 screen. This level 1 screen, some of you may have heard level 1 screens referenced as what's called a PASSAR or a pre-admission screening for residential review, which is done in a hospital setting for individuals who are transitioning into a long-term care facility. This level 1 screen is different. It is meant for community-based individuals who want to gain access to the Community Options Waiver Registry. And if you don't know what that is, I'm going to tell you about it in just a moment, so hang tight. But a level 1 screen is a preliminary evaluation of risk for institutionalization. What that basically means is it looks at activities of daily living and the instrumental activities of daily living to address an individual's needs and their risk of institutionalization or their risk of being placed in a skilled nursing or an assisted living facility. These screenings are entered into what's called the LTSS Maryland. It's an online system that we've input all of these screenings into. This screening is typically part of an initial intake process for anybody who is seeking some support around their activities of daily living. Maryland Access Point, as well as some Centers for Independent Staff or Independent Living staff who work in partnership with MAPS, are the only staff across our state who are authorized to do a level 1 screen. And the level 1 screen is the only way that individuals living in the community can access the Community Options Waiver Registry. Next slide, please. MAP is performing this screening for a variety of reasons. As I stated earlier, we're the single entry point. We're that no wrong door for the state of Maryland, and we provide a single entry point to the community Medicaid services here in Maryland. So in order to access things like Community First Choice, Community Personal Assistance Services, or the Adult Day Waiver Program, or even the Community Options Waiver Registry, which are all Medicaid programs, individuals have to have a level 1 screen to determine potential eligibility first. It's the first step in the process of gaining access to Medicaid services and support in Maryland. The screening itself allows Maryland Access Point to gather information to help people plan. It also helps us triage individuals into services more effectively and use other public resources to support an individual while they're on wait lists for Medicaid services. If any of you have ever tried accessing Medicaid services, oftentimes they're a long wait list and things do not move quickly in many of these programs. The application process is quite lengthy. The determination for eligibility is also lengthy. So we as MAP assess individuals and help triage them into other programs while they're in queue or while they're waiting for other services and supports to get started. The screening helps us determine service needs, risk of institutionalization, additional referral recommendations that come out of the conversation, other topics and suggestions for person-centered planning that then can happen through Maryland Access Point or MAP options counseling process. Options counseling and the level 1 screen typically go hand in hand because the level 1 screen goes quite in depth. There are 33 questions that ask a lot of information about an individual's needs, and it helps us better understand more holistically what an individual needs rather than the simple thing that they're calling in with. Oftentimes people call in with one issue. Let's say, as an example, I don't have access to food, or I need home delivered meals. I'm not able to get out and get groceries and I can't prepare meals anymore. And there's oftentimes so many things that have led them to their current situation. And really this screen helps Maryland Access Point understand all of the things that are happening in individuals' lives so that we can help address the need that's immediate and keep it from happening again by supporting in lots of other areas. Next slide, please. As a result of the level 1 screen, there's a lot of things that we can do. Maryland Access Point staff can add individuals to the Community Options Waiver Registry, which is ultimately a wait list for the Community Options Waiver. There are about 20,000 individuals on this wait list currently. The wait list is based on priority. So individuals who have the greatest risk of institutionalization are pulled off of that wait list first, rather than based on kind of a first come, first serve basis. So this screen helps people, helps determine the priority grouping for each of the individuals when we're adding individuals to that waiver registry, so that the individuals who are most at risk of being institutionalized or put into a skilled nursing facility and ultimately would need long-term care services or long-term care Medicaid can be invited to apply for the community options waiver first versus somebody who is at a lesser risk. As a result of the screen, we can also document and make lots of additional referrals for things like community first choice or community personal assistance programs, which are waiver programs that can provide personal assistance and other supportive services in the community. It can help us make referrals for the medical daycare waiver services program. We make referrals to core service agencies or behavioral health agencies in our community as a result of the screening. We refer people to the Brain Injury Association of Maryland, especially if they screen or indicate yes as part of their screening process that they have a history of a traumatic brain injury or a developmental disability. Again, we make referrals to DBA or even Veterans Administration if they screen yes that they were service connected. So we do a lot of additional investigation and referral as a result of this screening tool. Additionally, this screening is utilized to trigger an AIRS evaluation. If you've never heard of an AIRS evaluation, it's part of an NRI, Enter RAI assessment. I always have to slow that down. I always want to say it differently. But it is an assessment that is conducted by the health department to determine level of care that's needed for an individual. Part of the eligibility criteria for many waiver programs and services is that they have to meet a level of care that would support, would indicate that they would need institutionalized care. So our level 1 screen triggers that much more in-depth and costly assessment. It's kind of a precursor, if you will, and ultimately helps the state save money. It keeps people from having to do an AIRS evaluation who wouldn't qualify in the first place. And as I stated earlier, it also helps us connect individuals to other community resources and supports that would make the most sense for them based on the information they've provided as part of the screening. Next slide, please. This slide's just to kind of give you guys some additional information about the community options waiver for those of you who may not know. In the community, you cannot apply directly for the community options waiver program. You instead have to be added to a service registry or a wait list. That service registry was developed to, again, help prioritize the individuals who need the services most. So in order to access some of these services, individuals have to be added to the wait list unless they're in a skilled nursing facility. So it is important to recognize if you're in the community, you have to go on a wait list. If you are in a skilled nursing facility and are receiving long-term care Medicaid or have been institutionalized for 6 months or greater, you have access to what's called Money Follows the Person options counseling, which looks very similar to MAP, except for it is specifically for individuals who are institutionalized, and it's to help support them to make the transition out of that skilled nursing facility back into the community. And again, all of these same services and supports are provided as a part of that process. So it's an extension of MAP that serves individuals who are already in a skilled nursing facility. Community options waiver, for those of you who aren't aware of what it is or what it does, ultimately it helps individuals pay for things like assisted living, medical daycare, helping individuals and their family get the training and support they need to better provide family caregiver support in the community. It helps by providing case management. So, a skilled social worker is able to work with family, work with caregivers, and kind of do some case management to organize care and create a plan of support for the individual in the community. It can help individuals access Senior Center Plus or get access to dietary or nutritional services and needs and supportive services. as well as behavioral health support. It also allows individuals to access community first choice, which can provide all of the other things that you see listed on the screen, things like personal assistance services, nurse case management, transportation, transition services, home delivered meals, pharmacy can help pay for medications or durable medical equipment that might be needed. So in order to access these programs, it is important also to note that you do still have to, even when you come up on the wait list. So let's say you're sitting on the wait list for 6 months, a year, 2 years, and your name comes up and you get an application to apply for the Community Options Waiver Registry because you are in great risk of institutionalization and it is determined that you have a high enough priority and get that application in the mail. You still do have to meet eligibility criteria, and eligibility criteria is based on several things. And that in and of itself is a whole different training. Next slide, please. When talking about MAP options counseling, so we do information assistance referral, we provide level 1 screening, and then we also provide MAP options counseling. Options counseling is that person-centered counseling and support around everything else. It addresses the holistic needs of an individual, providing that unbiased counseling based on an individual's goals and their preferences. As an example, maybe it makes sense to refer an individual who's potentially eligible to Community First Choice. Community First Choice only provides an individual who is a paid caregiver through a contracted professional setting, and the individual absolutely does not want a stranger in their home. It may not make sense to refer an individual to Community First Choice. So we take the individual's wishes and their goals and their preferences into consideration when deciding or helping the individual decide what's best to create that plan of care for them. It helps individuals to explore all their long-term services and needs. Long-term services and supports. And again, helps them make those better informed decisions. MAP options counseling goes hand in hand with the level 1 screening process oftentimes, and is oftentimes offered by appointment because it is a much more in-depth dive of an individual's needs, addressing all of their concerns. And of course, it is for individuals who are living in the community. If you're looking for something similar in a skilled nursing facility, you're looking for money follows the person options counseling. Next slide, please. All right. So how do you connect with MAP? Each of our MAP sites are set up a little bit differently. I had mentioned earlier that some of them are embedded as part of our area agencies on aging. There's one in the state of Maryland that is part of the health department. There are a few that are part of a nonprofit organization, but all of them can be accessed through these resources. So you can call. We have an 800 number, 1-844-627-5465. That is a MAP dedicated number that's answered in partnership with Maryland 211. 24 hours a day, 7 days a week. You can get access to information and assistance over the phone, and then a warm handoff or referral to our local offices if you need things like the level 1 screening or options counseling or a little more in-depth application assistance or assistance with connecting to resources in your community. You can connect with us online. We have a searchable database on our Maryland Access website, our Access Point website. You can also find the location and contact information for each of our 20 local offices there on the website as well. And then lastly, of course, you can visit any of our MAP offices in person. Many of the services and supports that I've referenced today, they do require an appointment. If you do have an immediate or urgent need, you can absolutely walk in and information and assistance will be provided to you. And at a minimum, you'll get an appointment made for you. So you can kind of interact with us in several ways. Next slide, please. You can also interact and learn more about services and the programs that I mentioned that are offered through the Department of Aging by signing up for our e-newsletter. You can do that right on our website. If you click on maryland.aging.gov, there's an opportunity to sign up for a newsletter that gets mailed out monthly with upcoming events, news announcements, press releases, tips and resources for older adults and those living with disabilities in our community to better support Marylanders. Next slide. You can also interact with Matt via text. This is not an interactive, I shouldn't use the word interactive. You can sign up for texting alerts, let's put it that way. If you text MD Aging to 898-211, you'll receive right on your handheld device alerts, tips, resources related to aging, and how to support the needs of older adults directly to your cell phone. We send out reminders about different awareness events, things coming up in your area, if there's going to be inclement weather, how to stay safe in that weather, all kinds of different things as a way to keep people better informed in the state. Next slide. We are also on all of the social media channels, so you can like us. And when I say us, I'm talking about Maryland Department of Aging on Facebook, Twitter, LinkedIn, Instagram, and we have lots of videos and things that can be really helpful in learning more about our services and supports on YouTube as well. So do like us on the social media pages and interact with us there. Lastly, before I turn things back over, I just wanted to quickly share about 3 additional programs that are some special initiatives that have come out of the Maryland Department of Aging that have come out of some of our partnerships and our coalitions and our groups who have identified gaps in services or needs in our community. Next slide, please. First program I just wanted to quickly share is a program called Community for Life. The link to learn more about the program is embedded in the web or in the slide deck that you'll receive after today's presentation. But it is a fee-for-service program that addresses the needs of individuals who are living in the community who are slightly over income for traditional benefits and services, but still need some support and are unable to potentially pay independently out of pocket for a lot of these services. It provides home maintenance, service navigation, and transportation resources for individuals in the state of Maryland in many of our counties. We are looking to expand this program to all of Maryland's counties. Currently, we're in 13 counties across the state. So to learn more about that program, please click on the link and find out if it is available in your county. Next slide. We also operate what is called the Maryland Durable Medical Equipment Reuse Program. If you've never heard of this, you are missing out. This program is amazing. It is something that was created to address 2 issues. Many individuals who need durable medical equipment don't have access to it. And there are lots of individuals in our state who have access to durable medical equipment, who want to donate it, and they don't have a safe way to do it. So all of this durable medical equipment, which, as you know, is very costly, ends up in landfills. So this particular program has lots of different implications. We have some environmental impacts in that we've removed enough durable medical equipment from our landfills in the state of Maryland in the last 2 years to fill 16 2-story homes. That's a lot of durable medical equipment that's not in our landfill, polluting our space, that is being refurbished, cleaned up, sanitized, brought back to new condition or like new condition, and pushed back out to community, to individuals who need it most. This particular program is accessible to anyone in the state of Maryland, regardless of age, regardless of injury, regardless of disability, and regardless of cost. It's a free in, free out. Most of the durable medical equipment has been donated to the program. It gets sanitized through a state-of-the-art sanitation process, really very cool setup that gets every little germ and microbe off of the equipment, makes it safe for reuse. Everything is inspected. If things are worn, it gets replaced and it is ready to then be donated back out into the community. Crutches, canes, walkers, wheelchairs, Hoyer lifts, motorized scooters, you name it, we have it. It's a really cool program. If you have not heard about it and you know of individuals who might benefit or need some durable medical equipment, you can find out more information on the website that's listed there, or you can email or even call the information that I have there on the screen. Next slide. And then we also have a program that addresses the needs of individuals who especially of those that are living alone in the community across the state of Maryland. When you live alone, you worry about falling and somebody not knowing that you've had a fall and not being able to get to the phone for long periods of time. And as you know, I'm sure each of you have heard a story at some point, whether it have been on the news or even a close personal relationship with an individual who has had a fall laid for a long period of time, and it was detrimental to their health. This particular program meets that need or addresses that issue. It's called, I'm sorry, I just realized I didn't change the title on this slide. I should say Senior Call Check Program. The Senior Call Check Program is a free daily check-in call for Maryland residents who are 65 and older. It is a robocall that happens at a predicted time. Thank you, Wendy, for doing that. Real time, I love it. It is a robocall that happens at a predicted time or a prescribed time each day. So I, as the participant, get to pick the time that my call comes in. The call comes in, all I have to do to say that I'm safe is hit any button on my phone. I have the option to continue listening, and I'll get some additional educational information, alerts, and just good information to have to help me better age in place. But it's really very simplistic. If I don't answer, this is where the value of the program comes in. If I don't answer, another call is placed to me. If I don't answer the third time, a call goes to my emergency check-in person. So, I can identify anybody I want, a neighbor, a friend, my daughter, my son, whomever, right? If that person is unable to be connected with, and we can't ensure that the individual who we're trying to reach is safe, after an additional call, a call is made to initiate an emergency check-in with the local emergency responders. So this program really can be a life-saving program, especially for individuals who are living alone or maybe have frequent falls or have some sort of medical condition that they're concerned that they may lay for a long period of time and nobody's checking in on them. So really great program. To learn more, to sign up, you can go right to the website that's listed on this slide. Last slide is just my contact information. If you have questions, concerns, I'm happy to answer them now, or you can certainly interact with me after today's presentation. So thank you for your time, and I'm going to turn it back over to Wendy.
Thank you so much, Amanda, for all this valuable information. Really appreciate it. I actually had a question. I was wondering, that was a really impressive number, 47,689 touches within the state. How many MAP staff are there statewide at those 20 agencies that you mentioned?
That's a really great question. So in 2023, which just ended our calendar, our fiscal year, no, I'm so lying to you. That would have been FY 2022. 23 hasn't ended yet. So in FY 2022, we had about 125 MAP staff across the state. We have expanded that number quite a bit in the last couple of months. I would say there's probably more like 170, 75 or so staff across the state currently. Some of our jurisdictions are a team of 1 or 2, and then some of our larger jurisdictions like Baltimore County specifically, or Baltimore City, have a much larger group of individuals who are providing this service. I think the largest MAP office has about 10 staff who are doing this work.
Great.
It's a pretty huge reach for a small group of people.
That is huge. I had one other question too. You had mentioned the relationship with 211 Maryland, and does that serve as like a triage for MAP? And did those calls or the main number that they call in, does that count as the referral then over to the MAP lines? Or is that like a separate, or are all those just going to the actual services? Like so what percent of 211 Maryland do they answer the calls for MAP?
That's another really great question with a lot of potential implications, or a lot of things that I could address. Okay. So let me just try to address all of them. So ultimately, our partnership with 211 came out of the COVID period. We received some funding, and we were specifically looking at or charged with increasing the capacity of Maryland Access Point. Our our website and our map link number, that 800 number that individuals have access to call and get access to 211 resources currently. Prior to our partnership, that number, that 800 number, was a centralized number that anyone could call from the state, and it literally just routed you to the MAP office in your zip code. And there wasn't real-time assistance offered. So by partnering with 211, we did help increase capacity to serve by getting, as you said, kind of that triage set up. So individuals can call the MAP link number anytime, even outside of business hours, and get some support right now. Providing kind of some simple information and assistance around different community-based organizations and supportive programs that exist in communities. The 211 resource database isn't maybe as comprehensive in every area of our state. And a lot of calls from the 211 answered MAP link number still ultimately get routed to our local MAP offices. What we have found through this partnership is that there are many more 211 specific calls being routed to MAP than ever before, because as part of this partnership, we've kind of done some dual training. So 211 staff know more about what MAP is doing, and MAP knows more about what 211 is doing, and we lend resources to each other. We are helping actively on a regular basis as MAP staff, the 211 staff build their resource library. And that resource library is now what lives and breathes as part of our MAP website. So we're working to make this a stronger partnership so that everywhere that individuals connect with MAP, they're getting the best potential information and high quality resources as possible.
Terrific. Thank you so much. We had a question in the chat from Tammy Halterman, Calvert County Health Department. She was wondering, where do you donate the durable medical equipment? Would that be the local office on aging? Who qualifies to get the equipment if they need it? And if you had any information about that, or is there like a warehouse that it has to be centrally donated to?
Again, really great questions. So the durable medical equipment actually does have a centralized warehouse. You do not have to take that durable medical equipment to that centralized location. We have lots of satellite sites across the state that serve as distribution and collection sites. So we have 2 large trucks that go to those sites and pick up and or distribute in equipment where it's needed. So the area agency on aging is not responsible for taking in that equipment. Some of our area agencies on aging are that point of contact. Some of them do not have the capacity or the space to store it, because everything has to be, when you're taking in durable medical equipment that's been used, there is that potential for it to be, covered in germs and things that we don't want, staph, C. diff, those kinds of things. So we want to make sure that there's a space that's safe, that things can be stored and sanitized properly, and make sure that everything's repaired. So everything comes from the collection sites across our state back to a centralized location where all of that work happens, the sanitation and the refurb, before it can go back out into the communities. The collection sites across our state are listed right on the website that's embedded as part of the slide. So you can find where your closest distribution or collection site is. And if you happen to find that when you click on that, there isn't someplace close to your site, reach out and let us know if you have any ideas on partners that can help with that. We're always looking for ways to expand the program, to increase the number of collection/distribution sites. Some of our collection sites quite literally are even co-located with our landfills across our state, which is really cool. So, I drive up to the landfill, I'm ready to, chuck, somebody's walker into the landfill, and there's this really great bin that says, please place your durable medical equipment here. So, it happens a little bit of everywhere, all across our state.
Terrific. Thank you so much. I'm going to turn this back over to the group. Are there any other questions for Amanda that you'd like to unmute yourself or type in the chat? Okay. Well, thank you again. I want to make sure that everyone's aware, next month on Thursday, April the 20th from 1 to 2, we're going to be talking about food insecurities and SNAP. I'm gonna stop the share and turn this back over to Leanne. And thank you again, Amanda.
It was my pleasure. Thank you for the opportunity.
Hey. Leanne, you're here?
Mute, I'm sorry.
That's okay.
Thank you, everyone, for joining us today, and thank you, Amanda, for all that wonderful presentation and our ongoing partnership with MDOA. So I hope you all have a wonderful afternoon, and we'll be seeing each of you again soon, hopefully on the next webinar.
And I will be posting this recording as well as Amanda's slide deck up on our website. Once it's posted, I'll send everyone a link to receive that material. Thanks again. We'll see you next week.
Bye. Bye.